Occasionally, and at certain institutions, you may not have the lower frequency linear array I used in the previous video. If you have the curved linear array, which is a standard probe, we can do the same type of technique for finding the area of the iliopsoas. So I'm going to get onto the short axis, again, of the anterior-inferior iliac spine. I'm going to decrease my depth just a little bit. I'm going to use the arrow to point out the short axis of the direct head of the rectus femoris as it inserts onto the anterior-inferior iliac spine. And I'm going to slide the transducer slightly inferiorly until I see the area of the conjoined tendon of the iliopsoas sitting on top of the acetabulum at this point. So moving the transducer slightly medial, we'll see the important structures of the femoral artery and vein, femoral artery and vein, and this is to be avoided in any type of injection technique. As I slide the transducer slightly inferior, you will see the curvature of the femoral head and that little thin hypoechoic structure adjacent or just superficial to it, which is the area of the articular cartilage that sits on the femoral head. Now, to get into the position for an injection into the anterior capsule of the hip is I'm going to rotate the transducer in a clockwise fashion until I see the area of anterior or cephalad was going to be the area of the acetabulum, the femoral head neck junction, and then we can nicely see the shaft of the femur in this view coming right through here. Now, needle guidance would be right down to the area of the femoral head neck junction if the anterior approach into the anterior capsule of the hip is your desired position for intra-articular injection into the hip joint itself.